We are now joined by the Premier of KwaZulu-Natal, Nomusa Dube-Ncube. A very warm welcome to you, Madam Premier. Pleasure to have you on our show.
Thank you very much for having us.
All right, let's start then with the importance of, this kind of a hospital in a province like KZN. No doubt a lot of the state institutions have been overwhelmed over time. So to have a facility like this must be something wonderful.
Indeed, it is something of an excitement. It's something of a relief for us as a people of KwaZulu-Natal, for people in the township of KwaMashu, Inanda, Duzuma, Phoenix, Newlands, for us in the north to have this kind of a facility, which is a high-tech, state-of-the-art hospital. Really, it means a lot. It means that for people who would have had to spend 3 times taxis or buses for them to reach the tertiary institutions, can now even walk into the hospital, or when they have referrals or when they have admissions, people are now going to be able to access any other health care that they need.
I mean, in the clip that we played just before talking to you, we heard you there speaking about some of the expertise, that are being brought in to the hospital. Talk to us about that and just the facilities in general, what is available. We understand that, there's gynaecology there's a number of resources available, but maybe you could just, give some time just to speak to what is there.
Definitely. There is neonatal, pediatrician, there is occupational, there is all the facilities such as the x-rays you could find there. One of the best thing that also boosts this hospital is the e-health, what we call e-health. As you might know, that as KwaZulu-Natal, we've positioned ourselves as a smart province. So this is a paperless hospital. From the time a patient enters the door to the time when the patient registers themselves at the reception, they don't carry a single paper, they carry a number. And when they register themselves, immediately the doctor would know that they are expecting a particular patient, and whether it's an eye specialist, the eye specialist can do whatever examination. If a person needs to go to the next doctor will just pick the information on the computer screen. Or if a person has just been to x-ray, the doctor will be able to pick immediately those x-rays. By the time the patient reaches the doctor would have seen the results. The doctor would be knowing what to do with that patient. So it even decreases the number of waiting period for the patient. But also one good thing is that it's got all departments that you can find in any other state-of-the-art hospital you would find in that hospital that we have. As we talk now, it's also have what is called the easy circulation, which is a system that promotes even healthy environment within the hospital itself. It's got what is called day beds, where if there are walk-ins and they are just there for maybe a daily procedure, maybe dentistry or any other thing that they're coming in for, they can just do those examinations, maybe sleep there for those couple of hours and then be able to wake up and go home. It's got what we call a rainwater harvesting system. It's got energy saving system. It's got a number of other facilities that you'd not find in other, even hospital. The bed utilization right now is standing at about 82.1, which means that the hospital up to now, they've been able to service close to 38,000 people since they opened their doors. And this is really, for us, it's a huge milestone that tells us that this kind of facility has been much needed by the communities that it's now being able to service. Admissions are across all the discipline, And the theatre cases that, they registered up to today, there are more than 5,000 theatre cases that have been able to register, more than 37,000 X-ray cases that they've been able, to do so far. They have CT scans, they have MRI scans that are of high technology that is able to, within a minute, to say what kind of difficulty is this patient facing in the whole body. And it really is something that we're so proud of as the government of KwaZulu-Natal to have achieved this milestone.
Let's talk then about, the building process, the time that it took to get there. And I mean, I really want to put this at the back of the fact that, there's been a lot of criticism, obviously, about the government of KZN, but at large, really, the government of ANC in terms of infrastructure and in terms of service delivery and things like this, more of them being built around the country. Let's talk to this process, and perhaps this can be a learning curve, perhaps to other provinces.
Yes, the hospital started the actual piling of the foundation in 2012, and then the construction started in 2015. And the anticipated completion was in 2020, and unfortunately, due to COVID-19, there were delays. But what we were very happy with is that during COVID-19, we were able to utilize the hospital, particularly for COVID-19 patients. And it came in very handy because we were able to have proper isolation areas, proper facilities for young and adults and all kind of ages and any kind of ailments that people were coming with even during COVID-19. So really, although it took long time for us to commission it, but from 2019, we already started using it up till to date. As I said, that we've got more than 38,000 patients just on the daily that come on a weekly basis to come to the hospital itself.
Yeah, and how have the people of, say, KwaMashu and Phoenix and the other servicing areas received the hospital? I mean, I saw some clips of people talking there. I saw a gentleman talking about the fact that he's happy about he doesn't have to go too far to get a facility of this kind. So I think the issue of distance and access playing a huge part in this. But generally, how has it been received by the residents?
The residents have received this really with quite a jubilation, as you correctly say, that it has now alleviated, a huge problem of people, financial burden to communities that would have had to travel long distances. It has shortened the time, to definitive care by bringing the much needed, specialized services to the vulnerable communities. We've been able to clear quite a huge backlog of people that come from the township who need the district health care or the tertiary, health care. We've been able to implement very strong outreach program as well through this hospital, because what we also believe is that if we do a lot of outreach and education with the communities are able to understand what kind of things they need to do to prevent, certain things or living the, healthy lifestyle and many of those things. It has also, strengthened the rehabilitation services because if people need to come for, visits, they are able to come quickly. If they need to come maybe for orthopedic or for any other, care, they are able to come quickly, and they know that they're not going to spend a lot of time there because it is really within a walking distance of many of the communities around the northern parts of our Durban.
All right, Premier, many thanks to you. Thanks very much for giving us your time here on SABC News.